every single one of you. I salute you. And I just want to share with you again why I do this weekly. And these are my main reasons why I decide to take on this task, all right, of this free health education weekly. It's every Saturday, Ghanaian time, 4:30 p.m., Nigerian time, 5:30 p.m., and East African time, 7:30 p.m. So salute to every one of you on the call. Welcome. And these are the main reasons why I do this. Lack of health education in our schools these days. When I was young growing up, there was a lot of education in our schools, but these days we don't have such. So we have a lot of misinformation out there um, through the social media that we all use, and especially from unqualified personnel, all right, and they misinform the public a lot. And we all know that prevention is better and is cheaper than treatment or cure. So if there are ways to prevent certain illnesses, why not? So that's why I'm championing this course. There is very short contact time with health personnel. I am a health professional, so I know what I'm talking about. These days, there's very short contact time. Just as a short survey, right? So put in the chat box for my colleague doctors on the call who can also attest. Put in the chat box, how many minutes do you spend with your doctor in a consulting room? How many minutes when you go in and you walk out? How many minutes do you spend roughly, averagely? Please put in the chat box. Let's get interactive, all right? So that's one of the reasons, very short contact time with healthcare professionals. So we want to give you free knowledge, health knowledge, and answer most of your questions that you may not have chance to ask your physicians in the consulting room, all right? And most people want shortcuts. If you have a health condition that may be a chronic one, that may not necessarily have a direct cure, most people are looking for cure. Some things like hepatitis, HIV, asthma, people are looking for cure. Hypertension, diabetes, people are looking for cure when there may not be any cure as of now. So you need adequate knowledge on how to go about starting. So put in the chat box, let me just do a simple survey. How many minutes do you spend in a consulting room when you go to see your doctor? How many minutes? And specify if it's a government setting or a private hospital. Let's do this in the next 30 seconds. Let's know how many minutes you spend in a consulting room. Yes. Let's know how many minutes you spend in a consulting room when you go to see your doctor. Let's know if it's a government setting or a private setting. Let's know how many minutes you spend in a consulting room. I have 10 minutes, 20 minutes. Let's know how many minutes you are likely to spend in a consulting room when you go see the doctor. Let's know if it's a private setting or a government setting. We have 20 seconds more to finish this. Yes. Private government is less than 10 minutes. Okay, private. What you stated was private. Government is less than 10 minutes, less than 5 minutes, and it's a private setting from Williams. But let's know how many minutes you're likely to spend. We have 10 minutes to finish this. All right, 10 minutes to finish this. 10 seconds, sorry. 10 seconds to finish this. All right. So we have average 5 to 10 minutes. We have 15 minutes. We have 20 minutes as well. So these are my reasons why I decided to take on this task to help. And I'm blessed with a lot of colleagues and friends who are willing to share in the space to educate all of us freely. All right, 20 minutes and it's a private setting, 15 minutes. All right, thank you very much, guys. Thank you very much for sharing that with us. Now, so once again, I am your humble host, Dr. Albesedo here. It's a weekly program I host on YouTube and Zoom. And of course, the recording will be available on my channel as well. Feel free to subscribe. Let me just drop the channel link in the chat box if it's possible. Let me see if it's possible. Yeah, that's the YouTube link channel. You can subscribe. There are a lot of other contents from other specialists on the side as well for you to benefit from and share with friends as well. So today is a special one. What you are expected to hear from us today? We're going to talk about men's health. Now, if you are a man on this call and you are someone who cares about the men in your life, this episode is special for you. All right, we're going to talk about erection. All right, we're going to talk about erection. We're going to talk about erectile dysfunction. And along the line, we'll talk about prostate enlargement. These are issues that affect most men after 40 years, mainly. And a lot of people go doing a lot of things that harm them rather than the good they wish for themselves. All right. Like I said in the promo video, I said when it's early morning, it's not only the sun that is supposed to rise. Something else is supposed to rise in the life of every man. And if that is not happening adequately, there is a problem. And today we are blessed to have an expert. He's a specialist surgeon. He's a colleague, a brother, a friend. He works in the urology department of Kolebu Teaching Hospital. That is where they deal with men's health problems, talking about erection, a lot of other issues that concerns men That is where he works, and he's a specialist surgeon. Please join me, specially welcome a friend, a brother, a senior doctor for that matter, Dr. Enoch Taki, to share with us on men's health, erectile dysfunction, prostate enlargement, and others. Dr. Enoch, over to you, sir.
All right. Hello, Albert. Thank you very much, Dr. Sedo here. Thank you for this opportunity. I think I have to upload my slide, so just a second.
Yes, please.
All right. Is it? Can you see the slides?
Yes, clean and clear, sir.
Okay. Thank you very much. Thank you, Dr. Sedo here. Thank you, everyone who has joined us for this afternoon discussion. This afternoon, we'll be looking at erectile dysfunction and prostate enlargement. And if there is time, I would tackle issues on premature ejaculation, which is something that's of border to the growing young population. I want to start off with this quote by Leonardo da Vinci. Most of us know him, but he made this renowned statement and said that the penis does not obey the order of its master, who tries to erect or shrink it at will. Instead, the penis erects freely while its master is asleep. The penis must be said to have its own mind by any stretch of the imagination. So he tries to say that the penis does not obey any instruction. It has its own mind. It erects when it wants to. So that's from Leonardo da Vinci. But historically, the causes of erectile dysfunction had always been a natural one, that is, a man is incapable of accomplishing the act of sex. And also, some people in the past thought that it was more from a charm, an evil charm or evil spell. But I mean, presently, we have come to understand that erectile dysfunction may not necessarily be from supernatural cause, but there are certain scientific and evidence proving that it's from, arterial challenges. But I want to start off with erection. When we say erection, how does erection occur? Simply, the penis, as you can see on my screen, on your screen, is a spongy tissue, and in it has blood supply. So the blood has to supply the penis. And once there is stimulation, nervous stimulation, or during sexual, arousal, the arteries or the blood supply dilates, and that helps enough blood to be pumped into the spongy tissue. And once the blood gets there, there's what we call the veins that has to drain the blood. But this time the veins are compressed or closed so that they don't drain the blood that has been sent to the penis. And so by that, there is an erection. So you have that sustained erection, and then we call it tumescence, which means that you have an erection enough for sexual activity. So these are pictures that show the stages of erection. This is a flaccid penis. It's flat, and then you can see some superficial veins over there. And so once there is a tactile stimulation or a touch or any form of arousal, blood shunts into the spongy aspect of the penis, and then the penis starts erecting. Obviously, you may not have a very straight kind of erection simply because gravity may play a role in bringing it down a bit. So you have some normal curvature, which is not pathological. Now, when we talk about erectile dysfunction, it simply means the inability to attain erection or inability to maintain an erection sufficient for satisfactory sexual intercourse. In some instances, you may have both inability to attain and maintain erectile erection for sufficient intercourse. And simply, we've used the term ED to mean erectile dysfunction, and it has replaced the word impotence. So oftentimes now we don't use the word impotence, but we use the word erectile dysfunction. And it increases as we age. And so we have looked at from age 40 upwards, then you start experiencing erectile dysfunction. So as you age, obviously, if you take an 80-year-old man, he would have erectile dysfunction compared to someone who is 35. But presently, we've had young men, 28, 25 years, reporting with issues of erectile dysfunction, but predominantly it starts off from age 40. Erectile dysfunction is a very troubling condition. So I put up this picture, and these are couple who are not happy, obviously, because of this issue of erectile dysfunction. Oftentimes, the man gets to be the most worried. Usually, the women tend to console the men, but the man, for some reason, gets really, really worried. Now, there are causes of erectile dysfunction. We can group them into the organic causes or the psychologic or psychogenic causes. When we say organic causes, we mean there is some pathology or some disease condition that is contributing to that. Psychogenic causes tends to appear in all forms of causes of erectile dysfunction. It tends to showcase or feature in almost all the causes of erectile dysfunction, even with classification. So that tells us that the mind is also very, very powerful. So we start off with the psychogenic or psychologic causes. Oftentimes, you would have the situational type where there's problem with the partner. So when there's partner conflict, you tend to have, it tends to add on to the stresses that contributes to erectile dysfunction. So conflict among partners is a problem. And there are some men who are, lined towards sexual toys and sexual tools. And so once they meet their partners, they don't have erection because they get their pleasure using certain toys. And also we have what we call sexual performance anxiety. And I'm sure Dr. Albert Sodo here knows a lot about that. When you are anxious, because he is a psychologist, psychiatrist, he knows much about that. When you are anxious, it also plays a role in erectile dysfunction. So now I talk more about the organic causes. We have certain medical conditions like hypertension, diabetes that plays a role. For those who are diabetic, what happens is that you have issues with your artery. There's an arterial damage, arterial problems that affect blood flow to the penis. And so you tend to have erectile dysfunction. And there are, of course, hormonal issues. Some studies have shown that men with low testosterone, men who have low testosterone tend to have erectile dysfunction. Again, I must say that even it's been shown that for men who have low testosterone or the hormones levels are very low regarding testosterone, they still may have good erection. And so we have to take note of that. Neurogenic is here because there are nerves that help with erection. For instance, if a patient suffers from road traffic accident and injures his spine, it may have a role with poor erection, because once the nerves from the spinal cord are damaged, then it affects erectile erection. So this is what I have highlighted here, still with the causes. We have cardiovascular disease like hypertension, as I talked about, neurological problems if you have spinal cord injury, diabetes, and patients with high blood pressure, high cholesterol, what it does is that it leaves plaques in the vessels and they narrow the lumen of the vessel. And so blood supply to the penis is affected. I also talked about low testosterone levels that also contributes to that. Of course, obesity, and there are certain medications, a lot of medications that can affect erection. Example, you have the antihypertensives, most of them, especially the those we call the thiazides. But for us who are not, for those who are not in the medical field, most of the anti-BP medications tend to cause erectile dysfunction as their side effects. We also have some antipsychotics or medications that are given to the psychiatry patients. They tend to also cause erectile dysfunction. We have the SSRIs, those antidepressants, all playing a role in erectile dysfunction. So apart from that, there are certain lifestyles that can also play a role. For us, smoking is very, very important because it's been found that nicotine is able to inhibit the production of the molecule or hormone that helps with erection, which we call nitric oxide. So nicotine affects erection, and so smoking doesn't help, especially smoking tobacco. And I talked about depression and emotional failure. So this is a picture that shows what we call tumescence, which means that erection. So this picture shows complete erection where blood is shifted to the penile shaft, ready for any sexual activity. And this picture shows the flaccid kind of penis, as you can see. There's a bit about alcohol, which I want to talk about because some of us, majority of us do take in alcohol, and there will be questions whether or not alcohol affects erection. But the thing about alcohol taken in a small quantity is said to have to cause increased libido. In fact, it causes a lot of arousal and erection. And so when it's taken in smaller quantity, it has this, euphoria role that it plays and enhances erection. But when it's taken in large quantity, then its inhibitory activity comes to play. And so you tend to have poor erection when you take alcohol in binge. And for those who are chronic alcoholics, what happens is that their liver tends to become dysfunctional. And once the liver is dysfunctional, it causes decrease in your testosterone. And that's the hormone that is needed for good erection. So it's important we take note when it comes to alcohol. Obviously, this picture is classic. There's a woman who you can tell has been, her eyes are gazed on her man's manhood and hoping that there will be a rise. And the man who has lost his confidence, and you can tell the problem it causes to the family, the environment, and in relationships at large. Now, how do we manage these conditions? They are very troubling conditions, actually. And most of the patients we see in our clinic do come. And unfortunately, at our clinic, in a government facility where you don't have, your privacy is not guaranteed, they tend to whisper into our ears, they tend to write it on pieces of papers that they can't shoot. And so we know our clients very well, and we try to help them because now people are shying, or people are trying to be more open than in the past. And so management classically is based on shared decision-making and treatment planning. So when a client comes to the hospital, we try to educate them and give them all the treatment options that there are and then we also talk to them about the advantages and disadvantages regarding any of the treatment options. And so this is to help the patient to make an informed, decision. And that way the patient plays a key role in their management. So the doctor doesn't just throw in medicine or doesn't just give you he gives you the option for you to ask a lot more questions, and then eventually there's an agreement on what treatment option you wish to choose for yourself. So shared decision-making and treatment planning is key when it comes to management. Of course, when the patient comes, we evaluate the patient, we take a good history, we ask a lot of questions, we try to rule out any underlying conditions like hypertension, diabetes, obesity, and everything that there is, psychological issues, if you have problems with your spouse. I think recently, about 2 weeks ago, a newly married couple came to see me, and the wife came with the husband and said that they are married for about 6 months, and the man can't have erection, and his sex drive is very low. So I kept asking them questions, and the issue was not anything, medical, because all the labs were okay. But the challenge the man had was he's just lost his job. And so you can tell the stress that's on him. So I told him, it's coming from the fact that you've lost your job. So you need to reorient your thoughts, and then everything will come to play. But once they come, we evaluate them. We do a lot of labs. We check for the hormones, particularly the testosterone, to be sure if you are not having low testosterone. Once we do that, we try to find out the root cause of it. If it is something that is with your arteries that are not functional, then it becomes a problem. It means that this client will be a candidate for perhaps not just medical treatment, but it could be anything surgical to help the patients. But the treatment options I have here PDE5 inhibitors. I don't want to go much into details, but what it means is commonly we have them on the market as Viagra. As we all know, Viagra, we have sildenafil, which is Viagra. We have the Cialis or Targentis, which we call Tadalafil. Now, what this does is to ensure that there is relaxation of the smooth muscles in the penis. So the penis has a lot of smooth muscles, like I said, spongy tissue there, and the muscles are smooth muscles, and they need to be relaxed for blood to shunt into. And so that's the work of the Tadalafil, the Viagra that we have on the market. It's important to note that this presentation is also to let us know that we preach against people going just across any pharmacy to buy these things. Yes, they are on the market, but they have very bad side effects, especially the sildenafil, if the Viagra especially, because if you are hypertensive and you take this Viagra, what happens is that it can drop your BP to the very low. And so you have people who take Viagra and then eventually they die during sexual intercourse. And so, yes, you may have these medications showcased, but the message is not for you to go across street and self-medicate. They have their side effects, which you have to take note. Now, apart from the medications that I have talked about, there is something we call intracavernosal injection. What it means is that we have some medications that we inject into the spongy tissue or the smooth muscles within the penile shaft. As you can see, this is the man who has been taught how to inject this medication. We have what we call prostaglandins that are injected into the penis. And once they are injected, in the next 10, 15 minutes, 5 to 15 minutes, you should achieve an erection. And then you are good to go. After the sexual intercourse, the half-life just goes down, and then you achieve flaccid or detumescence. Sorry, I'm using big words, but detumescence means that you now have achieved flaccid, or your penis, your erection has reduced to its minimum. So this is what happens with the intracavernosal injections. They are also readily available. Then we have what we call intraurethral suppository. This one, you have some medication that you instill through the urethra. When we say urethra, that's the orifice where your urine or your ejaculate usually egresses or comes out from. So you have this medication, the composition done, and then you will instill it through the urethra. And once it's instilled, it causes it causes erection for a patient who has erectile dysfunction. Then we have medical devices that are also used. In fact, I think they are also available, but let me explain how it works. This medical device that you can see it's a cylindrical object, and then you have a constriction band here, and then you have the vacuum release button. So it creates, once you press on the vacuum or the power pump, it creates a vacuum, a negative pressure. So the negative pressure would cause blood to be drawn into the penile shaft. And once it's done, this constricting band, in fact, constricts it to prevent the backflow of blood. So for the period of sexual intercourse, the constriction band will be there to prevent backflow of blood so that you can have your erection. So once the erection is attained, you remove that cylindrical object, leaving behind the constriction band, then you can have sexual intercourse. So that's how the vacuum erectile device works. Then you come to the realm of surgery. In fact, now penile prosthesis is also available on the market. I think in Ghana, we've done a couple of them in Ghana. And so penile prosthesis or penile implant is also available. And this is a picture of it. We have the semi-rigid, and then we also have the hydraulic, what we call the hydraulic. But to explain how the penile implant works, you can see this cylindrical object here, and that cylindrical object is usually placed in one of the corpus, or what we call the spongy tissue, or the smooth muscles within the penis. It's placed there, and it has a bulb, that is the pump. And usually we place the pump at the scrotum, and then you have a reservoir that has the fluid. So the reservoir is placed abdominally, and then anytime you want to have a sexual intercourse, what happens is that you would have to press on the pump from your scrotum, and then it will cause the reservoir to release the fluid that would fill the cylinder. Okay, and then you have an erection. So once you have an erection, you can have sexual intercourse. And then when you are done, again, you press, and then it draws out the fluid from the cylindrical object, and then you have the erection reduced, as you can see in this diagram. I'm sure during the Q&A, we would have a lot of questions, and I'll best answer them. Quickly, let's tackle on benign prostatic hyperplasia, which is also a disease that is now being seen among the young population. It used to be something that is common with the old elderly. Every man has a prostate. We all have a prostate. And so we are all candidates of BPH. And importantly, from age 40 and above, your prostate gland starts increasing in size. We call it hyperplasia. The cell numbers starts increasing. And it's normal for everybody from age 40 upwards. If I should take everybody's prostate, I will see some form of growth in them. The only problem is that most men will report to the hospital when they have symptoms. And so it's not every man that would have symptoms, even with your prostate gland being enlarged. And so we'll go through the symptoms, and it's that simple. So this is the urinary bladder, as you can see here, and that's where urine is stored. And this is your prostate. This is the prostate gland that appears at the bladder neck. And this is the urethra, where urine will flow from the bladder, then it comes out. So you have the bladder storing urine. Urine follows this arrow, flows down through the urethra, and then it's brought out. But surrounding the bladder neck is the prostate gland. Now, if you have BPH or benign prostatic hyperplasia, like I've said, the prostate grows. So as it grows, you can see from this picture, it narrows the lumen of the urethra. So they become narrowed. And so what happens if you want to void and the outflow is narrowed, you have to strain. So patients will come in straining, and then also because they strain to urinate, just a little amount of urine would come out. And so they have poor stream. The urine that flows is very poor. Again, when they void or when they urinate, they will feel that there is still some urine in their bladder because they are not emptying the bladder completely. And then also some would have what we call intermittency. They are urinating and the urine just stops and then continues again. Others have what we call hesitancy. So they feel like going to empty their bladder. They go to the washroom. They have to stand there for minutes before the urine comes. That's what we call hesitancy. And then others have what we call the irritative or storage symptoms. They can wake up at night more than 3 times, which we call nocturia, to urinate. So some will come saying that they have to wake up for about 5 times before the night to just pass urine. So we call it nocturia. Others can't postpone their urine. So they go, for instance, they go to a funeral, they are amongst people, and the urine just comes, and before you realize they've wet themselves. We call it edge incontinence. So they can't even postpone their urine. And then there is also frequency. In a day, they are passing more than 8 urine, more than 8 times. It's called frequency. So those are the symptoms that accompanies enlarged prostate. Like I said, all of us will have our prostate gland enlarged, but not everyone would have the symptoms. Again, an important thing I want to say is that the symptoms does not correlate entirely with the enlargement of the prostate gland. Some may have the prostate gland very small, but they will still have symptoms because we have what we call the adynamic aspect of urinary problems regarding benign prostate hyperplasia. And so the urinary symptoms I've talked about is not directly or does not correlate necessarily with the size or the enlargement of the prostate gland. So it means that somebody can have a very huge prostate gland, but may not have symptoms. Somebody may have very small prostate gland, but may have symptoms. So how do we manage them? Again, when they come, we take a good history. We will talk to you. We'll do certain investigations, particularly the serum PSA, which I believe most of us have heard about. The serum PSA would help us know whether we are really dealing with benign prostatic hyperplasia or prostate cancer, per the values that we see. And how do we manage them? Some may come with mild, symptoms, and so we'll go like, okay, maybe we should watch it and see how things go. But for all patients that come with lower urinary tract symptoms or the symptoms I've talked about, we start them on medications. We start with medical therapy, and then we review them over course of time. Some would be on medical therapy for so many years, so long as it's helping with their urinary flow. And for those that do not do well on medical therapy, or those that develop complications, i.e., some will come with bleeding, passing bloody urine, which we call hematuria. Others may also come with renal impairment or damage to their kidney, because what happens is that the urine does not flow out, so there's always a backflow of urine against this narrowed urethra here. So the urine, there's a backflow and high pressure generated here. So once there's backflow, it flows back into the kidney, and that becomes a problem. So once you have that, we try to operate on you. And again, if you have urine collected in the bladder for long, they undergo crystallization or hypercrystallization, and then you have stones formed in your bladder. That's what we call bladder stones. And so once patients come with this complication, again, they become candidates for surgery. So the surgery we do, we have the open one, which we call open. We cut you open to remove the prostate gland, especially the part where it's causing the narrowing of the urethra. We call it open prostatectomy. And then also we do minimally invasive surgery, endoscopic procedures, where we don't cut you open, but we resect the part of the prostate that is causing the narrowing so that urine can flow. So these are, surgical options available in our country, Ghana, and across board. Now, to the take-home message is that erectile dysfunction is common. It's very, very common these days, and we are not supposed to be shy about it. We have to report immediately you have such concerns. These days, because of a lot of educations and people reading a lot, you don't need to be shy about that. Also, concoction and herbal preparation can be dangerous. Buying things across board, herbal preparation, listening to your friends. Now they have what they call Cramine Cotte, excuse my language, but this is a concoction on the market. It said when you drink it, you have an erection like that of a dog, and people are taking it and it's causing problems for them. And like I said, treatment is available. Erectile dysfunction can be treated. And so you need to seek treatment. And again, self-medication is not helpful when it comes to prostate enlargement. So you need to always report. So I'll pause here and then take every question that comes for our discussion. Thank you very much, Dr. Sodo.
Thank you very much, Dr. Enoch. That was an elaborate discussion on erectile dysfunction and prostate enlargement. We appreciate you very much. Now it's time for questions and answers for the next few minutes. But I will just to summarize and reiterate some of the points that my dear specialist has stated. Smoking is a no-no. All of us men, especially, smoking is a no-no. And the bit about alcohol, which I just want to add to it, is that alcohol can be very deceptive. In low quantities, yes, you may have that euphoric phase where you may feel it's going to get you excited. But then tomorrow, the same quantity of alcohol you're going to take will not give you the same effect. So you're likely to increase the dose without knowing, just because you want to have the same effect. And gradually you see yourself consuming the whole crate. So alcohol, try as much as possible, as he advised, to stay away if possible. All right, we have enough alcohol in our fermented kinky and all that already. And when it comes to the chronic medical conditions, hypertension, diabetes, if it is properly controlled, you are safe. Yes, it is true. There are certain medications that we prescribe for you that may have erectile dysfunction as side effects. But again, we are not asking you to stop those medications because you may be having this side effect. Quickly report to your doctor, and the doctor knows what to do. The essence of this education is to avoid people going over the counter, taking a lot of concoctions. Mind you, most of these concoctions, if not all, are not FDA approved, which means they are not safe for human consumption. All right. So thank you very much, Dr. Enoch. Now, I just want to start off with the first question is, Doc, what is a place of prevention when it comes to erectile dysfunction and prostate enlargement? How can we prevent it? Because like we all know, Charlie, erection is important to all of us. What's the place of prevention?
Okay, so when it comes to erectile dysfunction, I mean, some of the preventions could be, especially the lifestyle modification, those that are as a result of, our eating, our dieting, especially truncal obesity, and then those that would affect our cardiovascular system, i.e. the hypertension and the diabetes. So the things that are within our reach, we need to prevent or stop it. For instance, smoking, we have to stop smoking. You have to stop smoking if you have erectile dysfunction, or if you don't want to, you need to stop. And then alcohol consumption. So things that are within our reach. We also advise exercise. Exercise a lot would also help prevent some of these things. Of course, you'd have to drive safe, because if you don't drive safe and you get involved in road traffic accidents without your seatbelt and you have spinal cord injury, it may lead to erectile dysfunction. And another thing that we tell married couple is that sometimes, you need to change things a bit, spice things a bit, some of the erectile dysfunctions that married people have is not because they have any organic or medical condition, but it's because the body has gotten used to a particular way of activity for long. So spicing things up a bit, you realize that they come back to you and they are happy. When it comes to prostate enlargement, again, it's the same thing. Eat well, but obviously the prostate enlargement is something that we can't run away from, because all of us are men and our prostate gland would increase, especially if you are from a family that almost every man has prostate disease. Then you have to be careful. That's when we recommend the annual screening for you as early as 40 years rather than the 50 years PSA screening, which we do at 50 years. But for those who have family history, we tend to do that as early as 40 years. And so for prostate cancer and benign prostatic hyperplasia, there's nothing much you can do but to pick it up early. And that can be that you report as early as possible. If you start straining, even when you are young, then we can help than you developing the complications. So these are a few preventive measures I can talk about.
All right, before I go into the comment section, our YouTube partners can drop their questions also in the comment section. We will attend to them online as well for you to receive your answers. Please put your questions in the comment section. Dr. Taki,
yes, sir.
What someone will ask, definitely. So let me just go ahead and ask for the person. 2 questions. In my reading, I came across cordyceps as a natural way to, boost your libido and erectile functioning. How true is that? And second question is premature ejaculation. What are the causes? So 2 questions in one.
Okay, so the cordyceps mushroom, there are a lot of publications about it. Like you rightly said, it's a booster. It tends to boost and then increase your libido, just like any, some food supplements that tend to do that. And so we are not totally against it. I mean, it's something that people have reported that when they took it, they got some arousal and they were very happy. They had good erection and they were very happy. And so it's good. I mean, it's good. But what you have to take note is that we don't use it classically to treat erectile dysfunction. So it's a booster, like you said, and I mean it's allowed. Another thing to understand in the field of medical science, the sildenafil was initially not for erectile dysfunction. They were using it to manage BPs. And then eventually the people realized that those who were on the medication realized that as much as they are controlling their hypertension, it was also causing erection for them. So out of something, we discovered something else. So I'm not totally against cordyceps. It can't help boost erection. The other thing about premature ejaculation, the International Society for Sexual Medicine, there's a whole group that are engaged in sexual medicine. What they define premature ejaculation is that you have penetration or sexual intercourse that lasts less than 60 seconds. Okay, it lasts less than 1 minute. Then you have premature ejaculation. There are a lot of causes. Some have said that erectile dysfunction works along with premature ejaculation. But for premature ejaculation, commonly, it has a lot of psychogenic issues. It could be from stress, anxiety related, sexual performance anxiety. All of them tend to affect premature ejaculation. And then also for patients who are on medications, especially there are certain drugs that really can contribute to premature ejaculation. And interestingly, it is one of the conditions that can easily be treated. Of all the sexual problems related with men, premature ejaculation is the easiest to treat. And so for men who tend to go through that, I would advise that you come to the hospital. It's the easiest to treat. There are a lot of ways to treat them. So these are the few things I would talk about. All right, thank you.
All right, thank you very much. Thank you very much. I just got some light out at my place, but I have a backup. So guys, you can hear me. There's a question in the chat box. Is prostate enlargement directly linked with infertility? If you can quickly take that, there are other questions as well. Okay, so prostate enlargement does not necessarily lead to infertility. The way the pathophysiology is essentially different. However, if you have cancer or the treatment of the prostate enlargement surgically can result in infertility, because once there are certain operations that we do that, your vas deferens is damaged, especially if you have a prostate cancer and we are doing a radical surgery for you, the vas deferens is damaged and so you have infertility. But to say that it's directly linked to infertility, it's not right. Okay, somebody's asking, can erectile dysfunction lead to low sperm count? Erectile dysfunction leading to low sperm count. What happens is that, there are certain instances that we've seen low sperm count with erectile dysfunction. Remember I said that low testosterone, becomes a cause for erectile dysfunction. So you may have low sperm counts with that. Okay, somebody's asking, kidney failure is on the increase these days. Can we say prostate is a key factor? Oh, yeah, certainly. Certainly, especially for the growing man. Most of the men I have seen, they come with renal failure and kidney injury, and we have to invite the nephrologist. Some of them would require dialysis. So obviously, if a man who is 70 years comes to your facility with renal failure, you need to examine the prostate. You may be dealing with prostate disease. Thank you very much. Can continuous exercise of the anal region make you last long in bed? Yeah, those are some of the steps that, psychotherapists have advocated. They teach a lot of things like Kegel's exercise, where you have to do more of anal winking and
some form of exercises so you last long. So it also does help.
That's a very interesting question. Joseph is asking, when he sees madmen, excuse my language, on the street, their penis is large and long, even if it's not erect. But most of the men, he's saying that theirs continues to become small and shrink. Why is that so?
For the women, they are not really interested in the size. They are interested in your performance and your skill. And so penile sizes really is a problem. One of the interesting causes of erectile dysfunction is what we call micropenis. If your penis is so small, obviously you may have erectile dysfunction. So penile size plays a role when it comes to erectile dysfunction, particularly the micropenis.
How long does the assisted erection gadget, like the pump, how long does it last? That's what somebody's asking.
Yeah, so it can last as long as, sex actually, studies have shown that averagely 8 minutes, 10 minutes. When it goes beyond 20 minutes, then it's a call for consent. So, but some of the young men out there have this weird notion that sex should be 30 minutes, 20. No, averagely it's 8 to 10 minutes. Yeah, okay. But the penile gadget, if you recall, it has a constrictive band here. And so that constrictive band here will keep the blood in the penis. And it should last as long as 15 minutes, 15, 20 minutes. And then it gets back. Then once you are done, the principle is that once you are done with the sexual intercourse, you have to release the constriction band. Because if it stays there for long, you have what we call priapism, sustained painful erection. It may not be painful most of the time, but you have sustained erection that is lasting more than 4 hours. And it's a problem for us as well.
Somebody wants to know, can masturbation cause erectile dysfunction?
Yes, it does. Masturbation, and then it can also even cause, premature ejaculation. So because for hand rubbing, it is some have said that it's the easiest way to achieve, orgasm, and then release. So masturbation does, and the more you do, the more it affects your erection. That's why I said that there are some people who would not achieve erection with their partners, but once they find sex toys and other means, then they start having erections. So it does play a role.
Does increased sugar intake affect erection?
Yeah, anything that would contribute to, like we said, diabetes, because everything that is eaten is not necessarily sugar, and you'd have a damage in your, insulin sensitivity, and you have type 2 diabetes, it can affect erection.
Somebody wants to know, does masturbation cause prostate enlargement?
This I know where the person is coming from. I don't know if you have heard of the 21 gun salutes, that they say in a month we should have about 21 ejaculation to save us from having prostate enlargement or BPH or prostate cancer. So every man is supposed to have about 21 ejaculation. That was an article that was written, and we can't substantiate that, but that was their finding. But it's neither that or not. The more you have this sexual activity, your prostate definitely would enlarge. Your prostate gland will enlarge. But whether or not it would play, it doesn't really matter. Hello, Albert. Hello, Albert.
Okay, someone says for him,
Hello,
when he
Albert.
involves in sexual Hello, Dr. Taki.
Yeah, can you hear me?
Yeah, I can hear you.
Oh, your line is bad.
I can hear you. Yes. So someone was asking.
Okay.
Hello, can you hear me now?
Yeah, I can hear you now. Yes, please go ahead.
Yes. Somebody was asking for him during intercourse. The first round, he's able to last for 2 minutes. But the
Okay.
second round, he's able to last for 20 minutes. Is that normal?
Oh, I mean, it's obviously your first round, you may last shorter than your second round simply because you have already achieved erection and then the flaccid period. And there are times that even achieving erection for the second round may take longer. So it's more in the brain. You've gone through it before and then you are going the second time. So obviously the latter ones last longer than the first. It shouldn't be a problem. Then my concern is that the women will rather wear out, especially when you are in 20 minutes and it's a challenge to the women, but it's normal. It shouldn't be a problem.
Joseph wants to know, does condom use cause erectile dysfunction?
Condom use does not cause erectile dysfunction. What happens is that there is a type of condom when someone has premature ejaculation, and as a way of helping them, we tend to advise the thicker condom so that when they wear it, they wouldn't have that sensation to release early or to achieve orgasm early. So that's what we use. We advise the thicker brand of condom for patients who have premature ejaculation, but it doesn't really cause erectile dysfunction.
All right. James wants to know, how long does it take to get a woman satisfied during sex? From the expert own mouth, they want to hear.
I mean, a woman's satisfaction for most of us, we think is often, penetrative. A woman's satisfaction is knowing your woman and knowing where to touch at the right time. So long as they have orgasm, if it's 2 minutes, 1 minute, they are okay. But usually it's the man's ego and the perception that we have to go 10 minutes, 15 minutes. No, for the woman, so long as you hit the right place, they are satisfied.
All right, Jones. So no doctor advises masturbation once a month. Jones, it's a lie. These are some of the reasons why we are having this conversation. No doctor advises masturbation once a month. And someone was asking, taking alcohol, does it boost a libido? The initial doses, yes, but I explained that the trick about alcohol is once you take it, the next time you are taking it, you want to take more to have the same effect. And over time, it's what we call tolerance. You might end up taking much more, which will end up having a negative effect of you having erectile dysfunction. Dr. Enoch, do you have anything else to add to that?
Oh yeah, I think I agree with you certainly on this. So you see, once you take more, it starts creating inhibitory, function, and then you have the erectile dysfunction. And so if as much as possible you desist from it, once you start, you go for more, shots, and that would harm you.
All right. What is the use of alka-5 syrup? We have 2 minutes to bring it to an end. Our YouTube community, please drop your questions in the chat box. In the comment section, we will attend to every question to help guide you. Yes. So somebody asked, what's the use of alka-5 syrup?
Yeah, the alka-5 syrup, we have what we call, alka-5 on the market. It's not for these kind of conditions. It's for stone diseases. And for those who have renal calculus, ureteric stones, and then we give them alka-5, but not for sexual related issues. It's for renal stones.
Jones wants to know, can exercise help treat erectile dysfunction?
Yes, certainly. Exercise does help, especially if we are dealing with the modifiable causes like obesity, hypertension, diabetes. Exercise really helps.
Someone is asking, let me see who. Mustafa wants to know, if a man takes about 2 hours to get to the peak for the second round, is it abnormal?
It's something that we need to really look at because we have what we call anorgasmia. you are not achieving orgasm as much or as early phase. But for the second round, the second round is something that anything can happen. Some people don't achieve orgasm at all. And so I advise that if you've hit 1 hour, you are not achieving orgasm, you may as well hold on and stop, and then maybe give yourself another time, another day or two, and continue. But because the second round, anything is possible. You may not achieve orgasm.
Odum asked a very important question, which I'm happy he asked. He says, if you like eating wheat toffee, does it have any effect? Marijuana. If you like eating it, it's common these days a lot.
Yes, they take a lot of weed toffee, hoping that they would have orgasm. Like I said, the issue about priapism that I address, most of the young men that come with a sustained erection, they'll tell you that they took weed. Some would say they added weed to some drink just so they will have erection. The erection will come. But as to whether after you are done with the sexual intercourse, you would have your penis relaxing becomes a problem. So we advise against the weed toffee.
All right, thank you very much. Somebody's asking, orgasm and ejaculation, is it the same? All right, so thank you very much, Dr. Taki, for those. So we are here for prevention. We are here to promote things that will help us prevent these conditions and give you accurate knowledge. Now, weed smoking, alcohol, cigarette smoking, we are 100% against it. Dr. Taki talked about, now for prevention purposes, all right, you want to be able to detoxify your system because most of the conditions that we suffer, chronic ones especially, come about as a result of oxidative stress. A lot of things that are going on, chronic inflammation, a lot of all that in our system. So if you're going to take supplements, take ones that are FDA approved. Most of the Kramacorti and all those ones on the market, they are not approved by FDA, so they are not safe at all for human consumption. No one knows what may happen to you after you get your good erection. You don't want to suffer liver damage or your kidney damage after you get your good erection. So we are against over-the-counter, those concoctions that people praise a lot. And our butchers walking around, we advise against that. Now, the healthy products organic product you can to help to detoxify your system, to boost your immune system, and of course, most of them that are approved by FDA improves your athletic performance. The good thing is, I know of this product, Longevity, and the beautiful thing about this, like Dr. Taki said, cordyceps has been proven to help boost your libido, to help both men and women. And luckily, Longevity has cordyceps as part of its 13 other ingredients. Apart from boosting your immune system, detoxifying you, Longevity helps in that regard as well. Of course, I always recommend a combination with ATP, which helps your body to produce clean cellular energy. We see a lot of young men consuming a lot of energy drinks, which are not safe. It has a lot of things that are going to cause a lot of problems for you. These two products I openly recommend for a lot of people. I use it myself. A lot of people are using it. It's all organic. It's FDA approved. And a lot of people are having great benefits from. So if you want anything that can help you boost your immune system, detoxify you, can help you improve your athletic performance, feel free. Longevity ATP, you can always have it as well. All right. So if you have any questions, a lot of people have private issues. All right. You want to have your questions answered. Dr. Albert, my contact is on the screen. Thank you very much, Dr. Enoch Taki. Somebody asked a final question, which is how much does it cost? The pumps and the implants and all those things, how much roughly does it cost?
Well, I can't tell, an exact figure. Maybe I'll find out and let you know, but it's quite expensive. Especially in Ghana, we've done about 3 or 4 of the implants, and Kolibu, we've done once. We are yet to do some more. So I can't really, it's quite expensive though.
All right. So again, let's focus more on prevention. Thank you very much for all your questions. I hope we've been able to attend to them. Our YouTube community, we will attend to your questions. Yes, somebody, oh, the question I kept forgetting. Pascal wants to know what are some of the thick condoms that you recommended that prevent premature ejaculation? The brands of the thick condoms that you recommend.
The brand, okay. I mean, I don't want to turn anybody's brand into something else. So it's good you come to the hospital and then we'll let
advise
you.
Before you go, please, very important questions. A lot of medications on the market. Jones again wants to know, for penile enlargement, Doc, what is your take on that?
No, like for me personally, I always go like, you don't need medications for penile enlargement. If you have issues, micro penis, your penis is small, you are not satisfied about your penis, come to the hospital. We are surgeons and we know what we do to help, but going to buy medicine, herbal, it will not help. You rather come with what we call priapism. And with priapism, every week we have about 3 patients coming with erected penis that is not relaxing. And it's very, very worrying. So come to the hospital and we'll treat you well.
Yes. Thank you very much, Dr. Taki, for spending time with us. We appreciate you greatly. Thank you very much. All of us on the call, men, our target is prevention, exercise, eat well, drink lots of water. It helps clear your system of the toxins, and take only approved supplements that helps your system, not ones that everybody's just, that are not approved. All right, he mentioned one, Kraman Coty and the rest, please. Too much energy drinks is not good for us, all right? And most importantly, if you have any issue at all, go to the hospital. Go to the hospital and don't be shy to talk to the doctor about your condition. If there's somebody else in the consulting that you're not comfortable with, politely ask that the person excuse you so that you can share your concerns with the person, all right? Like I rightly said, so LGBT, a lot of us know about it. It has cordyceps and other ingredients that helps us to detoxify your system, boost your immunity, and improves your athletic performance. We say in the bedroom and the boardroom as well. ATP helps you to produce clean cellular energy on demand. Very powerful combination if you have them. And they are quite expensive, very expensive, but if you can afford, you get them, you have your own benefit as well. Now, this is a weekly program. So Dr. Taki has shared with us a lot. I will share the recording, will be on my YouTube channel. So those of us over here, if you have not subscribed yet to my YouTube channel, it's a new channel that I'm using to promote this weekly health talks. We are going to have lots more specialist friends who are willing to share knowledge with us for free to all of us. It's open, it's free. You subscribe to it, you click the notification button. Anytime we go live, you get to be notified. Next week, we're going to talk about very important, something that somebody even asked in the comment section, but I decided to just gloss over it. It's fertility issues. Fertility issues. I'm going to have a senior gynecologist specialist who is actually with us today about this session. He's going to teach us, lecture us, share with us on fertility in both men and women. So feel free, subscribe to the YouTube channel, put the notification button on, and invite as many friends as possible. Play back the video. If you joined us late, go to my YouTube channel. I've just put a channel in the comment section. Go to my YouTube channel and play back the video as often as possible to get accurate knowledge. We've answered a lot of questions, and this is coming from the expert. Once again, Dr. Taki, thank you very much. We appreciate your sacrifice. And
thank you for the opportunity to.
YouTube family and friends, once again, I'm your humble host, Dr. Albesedu here. It's been a plum, pleasing pleasure serving you all.